Okay, thank you. I want to also cover another lobular breast cancer question that we got actually through the chat. The person, so consider this patient case, diagnosed with lobular breast cancer, lumpectomy, 1 centimeter, HER2 negative equivocal, on letrozole. What happens when I have to get off this medicine? Mine is 100% estrogen. Doesn't body always produce estrogen at some level? So I guess the question is, why not stay on it?
So I think that's a great question.
If you can tolerate it, I guess. Yeah.
Yeah. So as I said earlier, the original studies kind of looked at 5 years as this awareness of the risk of late recurrence started to develop. We've looked more at 10 years, and there is even a little bit of data looking out to 15 years. I think it becomes an issue of weighing the risks and the benefits of extended therapy. And the longer we continue, we may see more and more downsides in terms of the toxicities. The other thing that we know is that taking endocrine therapy has a carryover effect. So for example, if you take it for 5 years, we know we see benefit out to at least 10 years and probably longer. So I think the optimal duration is not truly known at this point, and it may be different in different people. And we're hoping that we will be able to be more individualized in the future as the field advances. But currently, once a patient reaches the end of the planned course of therapy, be it 5 years or 7 years or 10 years, the standard recommendation is to stop.
And we don't know if it's harmful if people continue.
I think it's more just an issue of, added toxicities. For example, with an aromatase inhibitor, we have loss of bone density and things like that. And the longer we do that, the more problems that may occur.
Okay, great. So consider this patient case, and then we'll move to the other topic. Her doctor has recommended 10 years of tamoxifen. Is there a possibility that this could be shortened to 5 or 7 years if she continues to show no signs of recurrence? I guess we come back to the similar topic, but.
Yeah, so 5 years is a standard therapy. So if a woman does not wish to pursue longer therapy, I think that that's not unreasonable, particularly if she has a low risk. There is some data looking at with the aromatase inhibitors that suggests that 7 or so years may be equivalent to 10 years. But that would be sort of extrapolating in terms of tamoxifen, because the tamoxifen data is generally for 5 or for 10 years. But these are decisions that really need to be individualized, and with a one-on-one discussion with your doctor about the side effects and your kind of individual expected benefit from continuing the therapy, to see if it makes sense for you, to see if the added gains in terms of reducing the risk of recurrence outweigh